You are listening to the Opioid Affected Youth Initiative's podcast, Answering the Call. In each of the featured episodes, we will hear from experts from the field who will go in depth with their personal stories and experiences in responding to the opioid epidemic throughout communities across the country. This podcast is supported by the Office of Juvenile Justice and Delinquency Prevention. The opinions, findings, and conclusions or recommendations expressed in this podcast do not necessarily reflect those of the U.S. Department of Justice.
Hello, with excitement and delight, we present this fifth episode of Restorative Justice and the collaboration and coordinating efforts that can make a difference with the Opioid Affected Youth Initiatives. Research has shown that from 1999 to 2020, roughly more than 564,000 people died from overdose involving any opioids, including prescription and illicit opiates. This rise in opioid overdose deaths has been outlined in four distinct waves. The first wave began an increase in opioids in the 1990s. The second began in 2010 with a rapid increase in overdose involving black tar heroin, which was more potent and cheaper. And the third wave began in 2013 with an increase in overdose deaths involving synthetic drugs. And the fourth wave, according to the Center for Disease Control, opioid-related deaths were 31% higher in 2020 than they were in 2019. And of course, this extreme outbreak of opioid toxicity is caused by fentanyl-alterated tablets purchased on the streets. According to CDC, about 85% of overdose deaths involve illicit manufacturing fentanyl, cocaine, or methamphetamines. In 2020, about 56,000 overdose-related deaths involve synthetic opiates. And I tell you all this basically to get you to understand just how important how big of a problem this has become for our community, so we can start looking at things differently. These, in 2020, with the 56,000 overdose related deaths involving the synthetic opiates, it's the high potency makes fentanyl a powerful synthetic opioid that is highly dangerous and has become a significant health crisis affecting millions of adults and youth nationwide throughout the country. The Opioid Affected Youth Initiatives basically have tried to address many of the different issues that have surrounded youth in this country. Previous episodes have hosted mental health providers, emergency medical systems, law enforcement, and human trafficking perspectives throughout the country of things that's happening. Today, we're going to focus on how restorative justice basically addresses the issue and how it can help in the situation as it relates to opioids in the community and how it comes together. I am Dr. Rosezetta Bobo of Solid Solution Consulting Group, and we address issues engaging in restorative justice, community engagement, inclusion, mediation, diversity, and issues that address underrepresented groups and those hard to talk about issues within any organizations. However, today I am very excited when it comes to being in this space to talk about restorative justice and how it relates to bringing the community together. And with me today is my friend and expert in restorative justice, Mr. Landry of Village Architects of Tallahassee, one of the first fathers of restorative justice, with noticed founders with the likes of Gordon Bazemore, Sandra O'Brien, and Dennis Maloney. I welcome Del, and please join me in embracing his wealth of knowledge that he will bring to us today. Thanks. Hello, Del. How are you?
Thank you, Rosetta, and I want to say hello to everyone. I want to thank you for this opportunity to have this discussion about the use of restorative justice to address the opioid abuse that we're seeing among young people today. I became involved in restorative justice back in 1998 when I helped to set up what became the 10th National Site for Restorative Justice here in Tallahassee, Florida, at then the Neighborhood Justice Center. And from there, I have been involved in restorative justice when I moved on to work with the Balanced and Restorative Justice Project, which was funded out of the Janet Reno administration back in the late 90s and early 2000s, when they set up to do restorative justice nationwide. And I was thankful to be a part of that group along with Dr. Gordon Bazemore, with Dennis Maloney, with Sandra Pavelka, and others. But to that extent, that is what I've been doing, and I am still involved with it over 25 years later. But as an introductory, that is hello, and again, Dale Landry.
Thanks, Dale. I so remember the training when we were doing that down in Fort Lauderdale, Florida, when Dennis Maloney and Gordon Bays were some of the four founding fathers, I should say, of restorative justice was a piece of that, a part of that practice. And what was so most important was addressing, not arresting. And the question became, can restorative justice be used by the juvenile and criminal justice system to reduce juvenile opioids use and recidivism while serving them at home and within their communities, thereby providing more opportunities for children and families in the justice system? And we've tried throughout the country to at least address this and many other issues as it relates to how we address the different drug use or abuses that takes place in our society and our system, as to how do we address issues when it comes to addressing different things that we label as crime and this crime within the community and cause harm to us. So, Del, since you was started the piece with restorative justice, can you tell us first what is restorative justice?
Well, the best answer to give that I would like to use is what Howard Zare wrote in his book, The Little Book of Restorative Justice, in 2002. And he defined restorative justice as a process to involve, to the extent possible, all those who have a stake in a specific offense, and to collectively identify and address the harms, the needs, and obligations that resulted from it in order to heal and put things as right as possible. And we have all kinds of different ways of defining it. For me, that is the easiest and most fundamental way, is that restorative justice is about addressing the harm that is done, working with all that are involved, and then it's about coming back and rebuilding relationships.
Okay, great. Let me ask the question, can you think restorative justice can be used as an alternative to the current punitive practices being used by our juvenile and criminal justice system today regarding youth and opioid abuse?
By all means, because again, as I stated, when we first saw the balanced approach or the barge model evolve, that was directly what it was set up to do, is to find a less punitive manner to respond and to work, especially with juveniles. There were two areas we were working with. One was working with juveniles on the front end and trying to help them. At the same time, they're working with how to use restorative justice to reintroduce or bring people back into the community, i.e. from prison and things of that nature. But underneath the balanced approach, which addressed the juveniles, there were three ways that we focused on it, that we found justice, but we didn't have to be punitive. And it was done by coming back in and working with the balanced approach. We talked about accountability, competency development, and community safety, which were the goals. Accountability, it was to hold offenders accountable for their actions and inherent responsibility to go back and fix it. Competency development was a requirement for the community and the justice system to look at how do we come back and help these kids so they don't reoffend. So through a competency development, we start identifying skills to help them learn new ways and to address the harmful behavior by doing things more productive and helping them to develop better competencies and skills that could be life skills, that could be job skills, that could be a variety of skills to help them know how to interact and address the behavior that's keeping them in trouble. And the last thing is about community safety. What it said then was communities became safer the more they became involved in working with both the victims and the offenders to address the harm that was done. And therefore, as they became aware of what was happening, the opportunities and things of this nature, community could move forward to address them. So as we start talking about youth, and we're talking about this as it relates to opioids, back then they had similar things. But what we did was we came in and through that and the community becoming involved, we could identify opportunity to take those threats off the street so that the kids didn't no longer get into trouble.
So, are you familiar with any programs or practices that may be utilizing the restorative practice that may not necessarily be with opioids, but any process that can, this would work the same? Are you familiar with any, and how does that process work, or how has it worked?
Well, one of the things that we're seeing that happened again as a part of the evolution from that period of time, issues came up because we started having grandparents and grandmothers came up to us and saying, well, Mr. Landry, Mr. Maloney, uh, why do we need to wait? Is there things we can do before our children get into trouble? Are there things we can become involved with before that? And so Dennis Maloney and I sat back and we talked about it, and we came to realize we need to do some things preventive. We need to get involved, and we start identifying that the fact that when crime occurs, it did not occur uh, cyclic, but it was on a continuum. And through that process, we came back and we defined this thing called community justice, which became an evolution of the balanced approach of restorative justice. And the emphasis behind that was, let's go back into the community. Because we got to remember, before a crime occurred or before this behavior happened, we had a harmonious relationship in the community. But it was when that incident occurred, then we had division and divisiveness, where we had offenders and we had victims. But the community was often sitting back and not really being used to step in, becoming involved to embrace it. So this community justice model evolved. And out of the community justice model, what it came in and said is that a community is responsible for everything that's happening internally. And then what we need to do is pull the community of people together. And through this, we come back together and we use the community to help both the victims and the offenders. We come in and we address crime along that continuum. In that continuum, you got the occurrence of the causation of crime, you got the occurrence of crime, and you got the consequences of crime. To address that on a community justice model, we work with law enforcement to work with preventive measures to get rid of the causation. Let's get rid of that opportunity that's out there for these kids to get into trouble and to use this. When we are dealing with the occurrence of crime, we go back and use the fundamentals of restorative justice. We come back in and we use neighborhood accountability boards, we use circles, we use the various different practices to address the occurrence, and therefore we hold the accountability to competency development and community safety. And then as it relates to the consequences of crime, what we come back in is a multi-strategy thing where we involve the whole community. Let's go and identify all the resources in the community that we have, especially human service providers, to come in and work with these kids, work with all that have been impacted. Because we got them, they're sitting there, but we never did a concerted effort where we brought them all together under one umbrella so that we could all work together to deal with it. I don't know if that answers the question, but through the community justice model, and many are doing it, are the processes the best to address that.
That did answer my question, and I think I have a follow-up kind of, and that is that for those people who may be listening, who trying to figure out what do we do next, what do you think is the first step? Because I think we've been around with restorative justice for a very long time, and my question constant is that what's the fear of this process not working? Because it can work if you bring these together and you keep the, as you say, the youth within their own communities. You have the entire community involved in the process. What's the fear, or what's the apprehension that's stopping this from moving forward so we can address these issues and we don't have a system in place that we already know is tested and proven? So what's the first step that a community or someone would need to do?
Well, one of the things is they need to sit down and, first of all, come to realization. First of all, they need to own the problem. They need to own the situation. We're finding in our law enforcement, police are starting to say they can't do it themselves. And way back then, again, during the same time, they came up with this thing called community-oriented policing. Well, we're hearing that still, but we're not really embracing it. I think the ideal thing that we have to do is sit down and let the people, and they're doing it already because they're calling for help. They're already addressing it because the police are already throwing their hands up saying, we can't do it alone. We need the community. But nobody wants to trust them and let the community come in and have a lead role in addressing this. You see, because when we do a drive, when we get ready to go and try to set up one of these programs, and we really want to do it, first of all, we need to go and let the data show us where it's at. It needs to be data driven. The second thing we need to do is then be able to come together and pull a multidisciplinary group of people together. All disciplines, education, health professionals, both mental and medical. We need to go ahead and bring in the our faith community. Everybody's got to come to the table, because let me say this with you, what's happening. One of the things we're seeing this escalate to is into gun violence. It's evolving into gun violence because kids are needing to do things to help meet their needs. So that means ripping off people and things of this nature. It's impacting the whole community. And the more we wait, the worse it gets. So as we come in, we look at that, and as I said, it needs to be data driven. Go pull the numbers. It's out there. It needs to be multidisciplinary. All of our community disciplines need to be involved. It needs to be coordinated. But most importantly, it needs to be community oriented, and it needs to be community driven. When the community owns it, when the residents own it, it's their problem, it's theirs. But when the criminal justice system wants to try to take it and teach them and let them do it, it's police department's problem. It's everybody's but our own. So, I mean, the easiest way to do it is we need to come together. We need to have a conversation. We need to have a focus group. Then we need to come together and find the teams and find the people to make it happen. I don't know if, again, if I'm answering it.
Yeah, I agree. And let me say, I think that we're talking about opioids now, but I think that we started back in when we started the first restorative justice piece, there were other drugs and issues that we were dealing with. Do you think that we're itching because we're not addressing these as they happen one by one? And you said it must be data driven. And the data may not always show that it's what the type drug it may be in some cases. But do you think that we probably should still address the issue collectively as a community, as far as the court system, the law enforcement, the community? Do we address that in one entity, regardless what that issue may be, before it leads to something greater?
Well, it's been my experience, Dr. Bobo, that the data's there. It's just been my experience, because that's what led to it, is that the fact is, with the data that showed that we're having a problem with the kids getting access to the opioid. The key to it is this helps to awaken the consciousness of a community when they can see it, because everybody says, well, it ain't impacting me. It ain't my child. It ain't this. It ain't that. But now when we come and get the data, and the data is going to be given several different ways. Emergency room visits. And again, let's tie this in, especially, it's not just the opioid, it's the linkage of opioid with fentanyl. And through that process, we're finding it. And we're finding it based on, again, hospital arrest rates, even deaths. So the data's there, but it's through the data that it awakens the community and gets the community to give the response. And through that process, as I said, the response to the community, it needs to address, it needs to have a system level impact. All right. It should impact both when we say the criminal justice system, we got to lay it out. That's police, that's the state attorney or the prosecutor, that's the courts, and that's also corrections. And to that process, and especially we're talking about juveniles, we can integrate that, but we need to add one in there between police and between the community and the police. We need to add in schools, because it's showing up there too. And that's where a number one referrals of a lot of kids are coming from schools. And it's because they're in possession of these opioids at school, and some kids are even transforming and selling. So to that extent, it impacts our schools, and we need to see the change. We need to have process to interdict at each of these levels, so that we don't push the kids on down in the system, because many of the kids will see it in the community before they first even get into trouble. But nobody intercedes at that time. We need to create that system that allows that to happen. We need to have a continuum of care. Again, this goes to our mental health providers and our health providers in the community. We need to provide a continuum of care that both provides for them to work within the system, but also to be able to work within the community. And last but not least, we need to support the families. We need to give them what they need to continue to help their kids to remain drug-free.
Okay. I'm hearing this great information, Dale. I think it works, but I guess I still lay in the piece where where do we start? Where does this start? Because I think that this works great. I know restorative justice works. I've seen programs, I've worked programs, I've seen them work. But I still think the question must be why it's not working, or haven't worked, or not being implemented in many places, as to who is the starting point. Where does the starting point start? Once you get the data, once the data is out there, you follow the numbers, you know what it is. Who do you think it should start with?
What they do?
Let's say you don't have a program. Hold on a second, because with you, I know you had a program called Village Architect, and you could basically introduce to different places. I find now that communities are still looking for leaders to call. And in some cases, you don't have no identifiable leaders in these communities to call, but you still got the justice system, you got law enforcement, you got the community, you got the families, you still got those people in place. So my question to you for what would possibly help people, where's the starting point and where can we go to get that?
What I guess we have to reach out and find those people that have been involved with doing this work, that have been doing this work continuously over time. I'm aware of numerous restorative justice trainers and practitioners that are out there, but I can't sit and say I know many of them that look at it from a community perspective. Often restorative justice was done, as they call it, victim-oriented services, or it was offender-oriented. But in this case here, we're talking about community-oriented, and there are some that are out there. And I mean, this program doesn't allow me to list who all these people are and where they're at. But I would offer to you that I will leave information with the people that are helping to set this up, that if they have questions, someone wants to contact me, I can let them know. But where it starts at, where it really starts, is in a community that says we've had enough. Where it really starts is on those people that have heard from the police that we can't do it, we need community. And when community comes, they're sitting there trying to figure out what is it they can do. And they fail to realize there's a lot they can do. It just starts that we need to sit back, sit down, and go through a strategic planning process. And through that process, get everybody inclusively involved from a community to make this happen.
Okay. I know there are practices that they have, and you mentioned, I guess, one or two of them, but I remember the circles and the victim offender mediation and those. What are some other components of this process?
Well, when we start talking about circles have been used really to help create opportunity for people to learn about the harm that was done. And circles could also be used for a wide variety of things. For better want of a word, is a process that allows everyone that's sitting there to be able to participate at their level of participation, to address whatever the issue that they're looking to address. Some can be to hold people accountable for the harm that has been done. Others are just done for communication. I've seen circles be used by football teams to just sit down and have a conversation where they all become one in unity. The other ones that we work with are called neighborhood accountability boards. For in some places where you got criminal justice systems that are sitting watching, for many that's a quick means of accountability. And other ones that you have circle sentencing, you have victim offender mediation, you have victim offender dialogue, a variety of range of what they call restorative practices that can be used to address it. And some can be done in conjunction with others. So it doesn't mean that once I've done a circle, I can't come back and do a board, or once I've done a board, I can't come back and do a circle. They are tailored to the need of the people that are involved, the victim, the offenders, the victim and the victim support group, the offender and offender support group, as well as the community. The practice that's needed are used is essentially based on what is the goal that you're looking to do.
Dell, you made the statement about the circle. I will never forget the circle of training that we had when we did the circle in the initial training for restorative justice. I don't think I've ever, at that time, before then, and since then, been anything that was so powerful as far as bringing people together to talk. Because I recognize what the circle does is it talks about talking, sharing, openness, and involvement. Everybody in the circle is involved and have an impact and is valued. And I think that same piece is what we talk about when we start talking about bringing the community together, all parties together, because everybody that's in that circle and at that table have an impact and have a part as to how we can make a difference. And I think that's what restorative justice is all about, is restoring what may be missing from the whole process. So I think you really have touched a lot on how we get there and who all is involved, and the entire community is involved in the process. And I don't think we can think of it any other way. And I think where we may have fallen short, I should say, is because we're trying to do it without everybody being at the table. And until we get the data at the table, the data to get us to the table and get ourselves to the table, we're going to forever be fighting a battle where we're fighting against something that we can move forward and getting things done. And I think one of the issues you mentioned is that you may start with one piece of circle and recognize you may need a board, but it doesn't matter. You may have to circle back. But I think it's a matter of understanding the whole process when you make some decisions as to how we're going to pull restorative justice into addressing these issues. So do you have any closing remarks, Dale, about what can be done or what we need to do, or what just anything that would help anyone along the way of implementing restorative justice to address the opioid effects and to get the community more involved?
The only thing that I would offer is this, is whenever we do restorative justice, the community justice model, the one thing that I will emphasize is safety. Safety for all parties involved. Safety for the victim, safety for the offender, as well as safety for the community members that are involved. And if I had to capture the one thing that restorative justice does, the 3 R's: repair the harm that was done, rebuild the relationship throughout the community that were damaged and fractured. But finally, probably the most important part, it revitalizes the community in the wake of a harmful behavior. And to that extent, that would be what I would say, the 3 R's. Repair, rebuild, and revitalize.
Okay. That's a wonderful closing, Dale. I think those are 3 very important R's that can get us to where we need to be. Let me thank you so much, Dale, for taking the time. I know you have a busy schedule. Let me thank you for taking the time to share. And I'm hoping that this conversation will help somebody along the line to address some of the issues that may be occurring within their communities and throughout the country that impacts all of us. Let me also invite people to check out the other episodes that address these initiatives as it relates to opioids and that can make a difference that's been put on through this organization. So if nothing else, thank you all so much for listening. If you have any questions, please feel free to contact the agency. Thank you.
The Opioid Affected Youth Initiative is deeply committed to supporting the science and community-based efforts to combat the opioid crisis. The discussions that are part of these podcasts support this level of commitment. For additional information regarding the Opioid Initiative, visit us at www.opioidaffectedyouth.org. We also invite you to subscribe to our YouTube channel to view upcoming broadcasts, or simply send us an email requesting appropriate links at oayi-info@iira.com.